Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thank you again for joining us this week. We have another great show in store. Today I'm here with Dr. Marion McMillan with Synergy Spine Centers, and we have all kinds of information to talk to you about a cutting-edge procedure called outpatient endoscopic spinal surgery. So if you know of anybody suffering from spinal stenosis or who needs endoscopic spinal surgery, stay tuned because there's lots of great alternative, less invasive ways to help that person out of pain. Did I get that right, Doctor?
Yes, Jean, you did great. Thanks.
Before we get into that, why don't you introduce yourself and let everybody know who you are, how you got into this, and where you're located, all that good stuff.
Thank you, Jeannie. I'm Marion McMillan. I'm a career spinal medicine and surgery professional who for the first 10 or 12 years of my career used to be in what I refer to as the salvage business, where we would receive patients who had had big open spinal operations, sometimes the plates and screws, long rehab, a lot of complications, and try to return them to a quality of life that they had failed to receive initially. Well, fast forward a few years later, with all the technological accomplishments and achievements with minimally invasive surgery for all patients, now spine surgery has benefited from these technological achievements to where 90% of patients that fail conservative management can receive outpatient endoscopic spinal surgery in the place of open surgery with equal results and fewer complications.
Okay, there's a lot in that. So now me as the non-doctor, we're gonna tear it apart piece by piece. How's that?
Let's unpack it.
Okay, so let's just talk about stories, because I think that there's going to be folks that are going to be able to identify with us as we're talking about stories. So growing up, my uncle had, you must be so tired of this, because I'm sure you go to a cocktail party and they hear you're the doctor and you do this and they talk about all the pains they have in their back. That's hysterical. Back to you.
It's okay, we charge by the hour.
So, he was like a bus driver and going over all the bumps in Boston and the potholes and all. And he just had severe back pain. And I remember going for Thanksgiving and he couldn't sit at the table too long, but he couldn't stand too long, but he couldn't lay down. And this went on for my entire life growing up. I saw Uncle Kenny just suffer.
Yes.
And didn't want to do the surgery because of the repercussions,
yes,
possibly, of the surgery. So the options were not good. So without knowing about your procedure, what are most people being told?
Great question. Spinal pain in general affects 80% of adults at some point in their life, severe enough to seek medical consultation, and your uncle seems like a textbook case. Fortunately, most cases of spinal pain will resolve spontaneously with conservative treatment, chiropractic care, change in lifestyle, etc. But approximately 5 to 10% of patients fail what we call conservative therapy and are found to have conditions that won't remit unless surgery of some sort is performed. And that's where we come in. If you look at herniated disc, which most people have heard of, it affects 2% of unrelated individuals, or approximately 1 out of 50 people. But if you look at spinal stenosis, which is the primary focus of my professional practice, spinal stenosis affects 40%. That's 4 out of 10 people over the age of 60. And since people are living longer, the patient population is growing, where patients fail conservative therapy, they can't walk, and they're facing major spinal reconstruction, open spinal surgery operations with plates, rods, and screws that nobody wants. And so that's basically the context in which we come into the equation.
And when you're told about these surgeries, you're told, well, there's a chance that you could end up in a wheelchair.
Oh, of course.
And so who really wants to decide between that? Oh, well, the pain's not that bad. I'll deal with it.
Exactly. And not only complications associated with things going wrong, but even normal recovery after major spinal reconstruction can last anywhere from 3 to 6 months with an uncertain outcome at the end of the day. So clearly, safer, less expensive, less invasive options are very attractive to patients who are not comfortable leaving things as they are.
Okay, so you mentioned a 3 to 6 month uncertain outcome for the typical surgeries. How is that different when they come to you and you provide the outpatient endoscopic spinal surgery?
Good question. Endoscopic spinal surgery is the spine surgery equivalent of minimally invasive surgery in general on other body parts. And the biggest difference is that because the surgery is performed through a lighted tube, in many cases no larger than a pencil, the amount of damage to the normal organs to gain access to the diseased part is so much less. In fact, probably the first couple of hundred of operations that I did with an endoscope, we just did it under local anesthesia with conscious sedation, so patients didn't even have to go under anesthesia, which is ideal for patients that are elderly or perhaps folks that have heart disease or other medical conditions. So the access trauma, meaning the amount of surgical trespass that a patient has to suffer to even fix the injured part, is so much less with minimally invasive surgery. Patients walk out of the surgical facility an hour after we start. At the outside, perhaps 2 hours if it's a big case. Nobody gets admitted to the hospital, and recovery is typically 3 to 4 weeks instead of 3 to 6 months. The complication profile is 10 times less. It's just a major diversion from spinal reconstruction that was offered previously.
What is the success rate?
For leg pain, which is the primary indication for the operation, meaning leg pain, weakness in one or both legs, the success rate is well over 90%. For back pain, which is a lot more uncertain and not usually a strong indication to have surgery to begin with, if it's back pain only, most of those patients are not referred for surgery. But if back pain occurs in association with leg pain, again, you're looking at an 80% success rate for that. So the best indication is pain, numbness, or weakness in the legs that limits your ambulation and your quality of life.
Okay. So if you're just having the back pain, because I thought that spinal stenosis was, you'd see those folks bent over and they just needed that help to take the pressure off their lower back. And you often see them walking down the street and they're in like a 45-degree angle.
That's right.
Isn't that back pain?
It is back pain. But when you invoke the term spinal stenosis, by definition, it means that you have a pinched nerve. So the pain starts in the back, but because of the way spinal stenosis develops, the nerves are pinched, and when the back pain starts, it quickly transfers from the back into the hips, thighs, legs, and even feet in some cases. And those are the patients that need surgery in order to get going again.
So it's a severity level. Spinal stenosis would start in the back and progress. Correct. So they're saying still it's a surgery. We want to wait.
It requires an MRI diagnosis to confirm that you have spinal stenosis. And those are the patients that have the greatest degree of disability. But modern spinal medicine and surgical techniques are available for patients that don't have spinal stenosis as well. Mm-hmm. But the spinal stenosis patients are the most severely affected and the ones that have the least attractive alternative options.
This is wonderful to have this alternative, too, because my boyfriend's father-in-law, ex-father-in-law, had gone to Emory recently because he has spinal stenosis and herniated discs.
Correct.
He's ex-military.
Sure.
And he's 84. And so they elected not to have the surgery. And I said, whoa, wait a minute. I'm interviewing a doctor who's coming to my radio show. Right. I'm going to ask Dr. McMillan all about the options. I don't know if he's too old, but it's very encouraging to hear 60 to 90.
That's right.
So he's not, because it's minimally invasive.
That's correct.
Less complications.
And very attractive for patients who are seeking a less invasive alternative. The oldest patient that I've operated on so far has been 91 years old. The patient continues to do well over a year since his original procedure. He was in and out of the facility in an hour and a half, and he's doing great.
And you'd be surprised how many older people are active.
That's correct.
In their 80s and 90s. Until my grandmother slipped and broke her hip at 92, she was taking the public transportation in Boston to go in and get her hair done because she wasn't going to go to get her hair done in the suburbs. She was only 89.
Sure, absolutely. Well, it's because of the medical advances that we've achieved in heart disease, diabetes, high blood pressure, and the other things that typically compromise life for senior adults. We now have an expanding population of patients that will develop spinal stenosis and are seeking minimally invasive treatment options of proven value.
Okay. And I do want to talk about herniated disc too, but before we get to that, can we talk a little bit about the steps? Because you talk about conservative therapy.
Correct.
What is conservative therapy?
Yes. Conservative therapy for patients with spinal stenosis or herniated disc as well would initially include a period of rest, moderation of activities, perhaps associated with standard pain medications and or physical or chiropractic therapy. Typically, most of those conservative methods will be effective within 4 weeks, and patients won't even require an MRI examination if symptoms improve. For the second tier of patients, and this is something that I want to speak about with an increased sense of urgency given some of the recent news, you'll hear about epidural steroid injections. And unfortunately, we've had tremendous bit of bad news with tainted medications causing spinal meningitis in many cases, and in some cases death.
Right.
But that doesn't usually happen. But the epidural steroid injection, where an injection of cortisone with pain medication is injected into the spine, that will salvage perhaps an additional 50% of patients, at least in the short term, that do not respond to conservative therapy. And then finally, after another period of, say, another 4 to 6 weeks beyond the initial therapy, in the case of spinal stenosis or disc herniations, if patients have not responded to those conservative measures, then usually they have to leave it like it is and accept impaired mobility, lots of pain, or they consider some sort of surgical option.
And you know, that's where you hear of people becoming addicted to prescription pain medicine.
That's
and
correct.
it's a terrible situation to be in. You know, we can all be judgmental. We're healthy. We don't know what it's
Correct.
like to live in pain.
That's right.
You can have a perfectly wonderful person, ex-military veteran who was a Navy SEAL and hurt their back, and they're not getting treatment for living in pain. And quite possibly because I know with all these pain clinics popping up, now you have an alternative. You can actually go and get an outpatient, minimally invasive surgery where you couldn't before.
Correct. One of the things I always talk about in community lectures and even lectures to physicians and health groups is the quality of life issue that you've touched on. The Canadians have recently published a study in their health system where they specifically looked at health-related quality of life for patients with spinal stenosis in particular. It's worse than some of the common diseases of mankind that are known to be severe. For instance, spinal stenosis quality of life has been shown to be worse than heart disease, severe diabetes, kidney failure in some cases, arthritis in other patients. Spinal stenosis exceeds that in health-related quality of life impairment. And so you can readily understand where patients are seeking treatment. They don't want to leave it like it is, and the options that they're given sometimes are not very attractive.
And, you know, I'm not a nurse, so I'm going to qualify that, but I've done a lot of work in healthcare, and a nurse practitioner I knew used to always tell me, you know, Jean, the pain center in the back of your head at the top of your neck that tells you how much pain you're in is also directly related to your emotions. And so if you're in a whole lot of pain, it's going to make you depressed and anxious and sad. Is that correct?
Absolutely. I think experts disagree about whether it comes from certain centers in the brain or if it's just a reflection of the fact that you miss out on 90% of what life has to offer.
That's true, too.
But depression does go hand in hand with any severe functional impairment, and spinal stenosis is at the top of that list as far as the things that can cripple, impair you, or limit you from the enjoyment of life. You know, in many cases, your whole life you've worked and now you can't do anything.
I'm just getting so excited about this procedure, and I just want people to just listen to this show and call you and get information about it, because as we're talking, I'm also thinking about alcoholism,
Sure.
drug use, anything to wipe away the pain, and how that affects not just the lives of the person that's in pain, but their entire family, really, because they don't know there's an option out there to fix them.
That's correct.
And it's so sad, and it makes me feel so blessed to have this show, and I'm so glad that you came to join us today. But now I'm going to push you, because I'm thinking there's probably plenty of people, like my uncle growing up, who aren't 60 to 90.
Right.
And is that going to be an approved procedure for younger folks as well? Does age matter, or is it just
absolutely.
you're typically?
Absolutely. The technological achievements associated with the ability to do spine surgery through small endoscopes really broadly encompasses the entire field of spinal surgery for the majority of patients. Patients with herniated disc tend to be in a younger demographic, anywhere from 20 to 50 on the average. And the issue with them is returning back to work in the shortest possible time, as well as the associated complications of surgery that get expensive from an insurance point of view. And so in both groups of patients, we've made tremendous strides. And patients that have herniated disc are equally as good candidates for outpatient endoscopic surgery.
Wonderful.
At a considerable savings of money for the insurance carrier or whatever third party is paying the bill. So it's not quite as much of a risk to health or life or limb as it is with stenosis patients, but the convenience, the rapid recovery, the cost, and the minimally invasive character of the procedure is well received by patients of all ages.
Okay, so let's talk about cost.
Yes.
It's covered by most insurances.
That's correct.
And what is the typical cost of the outpatient surgery?
I have to give you a comparison between, so we know that we're talking about apples and apples. Typically, when someone has typical spinal fusion or spinal reconstruction surgery for spinal stenosis, the total outlay is anywhere from $80,000 to $100,000, depending on what is done. Now, for the elderly, the senior citizens that are on Medicare, the government pays a reduced portion of that bill, a negotiated discount rate, but those are the raw numbers. For regular spinal surgery, let's say on a healthy younger patient that has a herniated disc, you might be looking at anywhere from $15,000 to $20,000 because they don't stay in the hospital as long. The surgery doesn't require the same type of equipment or use of implants and all this other kind of thing.
And don't have to go to rehab.
And they don't have to go to rehab
Yeah.
usually and all that. In the case of endoscopic spinal surgery, the highest fee I think that I've ever seen a patient's insurance pay is about $12,000 to $13,000, typically anywhere from $8,000 to $10,000 total price. And again, you get tremendous savings on the back end because there's no need for rehab, fewer medications, you get back to work, so you don't have so much lost productivity and time away from your job. So I would say a good rule of thumb might be anywhere from a fourth to a fifth of the expense of open spinal surgery for the average patient when you consider the overall cost of surgery and recovery time.
And when you consider whether you can get back to work or not, it's a minimal expense to be able to make money and earn a living for your future.
Yes.
How did they just all of a sudden get active? I mean, after 3 or 4 weeks, they're not limited. How well is their recovery?
Well, see, again, you avoid going down in the first place. Patients walk into our facility with great difficulty. They walk out with a lot less difficulty. So they never really go down. Nobody goes to the hospital. You don't have to deal with recovery from bed rest and inactivity. So I would say typically patients take pain pills for 2 or 3 days, maybe a week or more, depending on what is done. But they never have to be admitted to rehab facilities or hospitals. And so the degree of impairment with your normal body function is so much less. So you avoid most of the things you have to recover from.
Well, and I'm just imagining when you're in pain and you don't feel good and you can't sit for long periods and you can't stand for long periods, exercise is out of the question.
Totally.
So you probably are heavier and not as muscular. And then you go in for this surgery and you come out, you don't have any pain. And all of a sudden, you could get active and much healthier and add years to your life.
Well, we don't want to
I'm
stretch
getting
it
too
much,
excited.
but for sure.
I'm just thinking no pain would mean I'm out there.
To avoid the functional limitations of disability, of major impairment in activities of normal health, exercise, normal living, you avoid the complications of a procedure, and yet you get all the benefits of having your problem solved. That is the message.
Well, we only have a few minutes left before we have to go to break. So what top 3 things do you want people to know about this surgery and Synergy Spine Centers, and what just so that they know whether or not they're a candidate to come and see you?
Spinal stenosis or herniated disc that has failed conservative therapy and is still considered disabling or severely limiting for the patient. Second thing would be a desire to avoid major spinal surgery and the cost, risk, and complications associated with that. And I think the third and final thing might be more rapid recovery and return to a better life.
So if somebody wants to get in touch with you regarding having this surgery, can you just shout out your website, contact information, and where you're located? We
are Synergy Spine Center, a regional leader in minimally invasive outpatient endoscopic surgery for herniated disc and spinal stenosis. We are located in the beautiful Lake Hartwell region at 457 U.S. Highway 123, right in beautiful Seneca, South Carolina, about 90 minutes from downtown Atlanta. Our website is www.synergyspinecenter.com. And our toll-free number is area code 855-770-8100. That's 855-770-8100.
And I understand there's only 5 or 6 centers in the entire country that are performing this procedure?
Far too few.
Far too few.
This is the next wave of medical advancement for a large proportion of patients that suffer greatly with spinal conditions that require surgery.
And how fortunate are we in Atlanta to have you right next door in Augusta?
Seneca.
That's
I'm
correct. Sorry.
Okay.
Well, I'm lumping it in as a region.
Sure.
Do you happen to know where the other centers are located throughout the country?
There are a few out west, one in Texas, and I think I want to say somewhere in the greater New York corridor. We're all colleagues. We serve the same population. There needs to be 10 times as many as there are. In fact, we think that this needs to be and will be the new standard of care for a generation.
That's wonderful. Thank you so much for joining us. Important information to get out there to our listeners. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead. And listen here, same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.